I'm Wendy Jayne, and I work with both Infinity Hospice and Nevada Palliative Care. So today, within, I'm going to say 7 minutes, I'll aim for 5, I hope to take those two terms, palliative and hospice care, and take some of the sting off of that and some of the fear out of it. So just give me a couple minutes to try. You know, palliative care is often used interchangeably with hospice and can scare people, and there's a misconception. While they share the same philosophy in that they are symptom management programs, they are not at home in practice the same thing. Nevada Palliative Care is a home-based palliative program. You may go to a physician and receive a diagnosis that's complex. It doesn't necessarily have to be terminal, but you may have several complex conditions at once. We may see somebody with COPD, heart failure, diabetes. They may be dealing with a lot of different moving parts and a lot of specialized physicians, and they're also dealing with the fact that it can be difficult to get to all those physicians, compounded by the problem that we have here in Northern Nevada, which is a shortage of physicians, so longer wait times. Nevada Palliative and Palliative Care is designed to bridge that gap for patients. One of the most common things that we see in our program is we've got patients who may be stemming up an infection and they can't get into their primary care. We can help with that. You give us a call, we can write prescription for antibiotics. And something as simple as that can have such large consequences if gone untreated. Then we end up in the hospital, and then we start to employ all of the people in this room behind the scenes. What's really great about today is that you get to see in real time kind of what we all do behind the scenes for each of our patients. We may be reaching out to memory care, we may be reaching out to Pam may be reaching out to us, we may be calling for chaplain services, we may be calling to find out about a power of attorney and trying to employ that for somebody. So we all work together behind the scenes. This is a great opportunity for you guys to see how it all works. But palliative care, when a physician is suggesting that, they're really looking at the level of complex care needs that a patient may have, and they're recognizing that there will be gaps and that we need to fill those. So we see our patients at home, and we do a variety of things, but primarily it's symptom management. Oftentimes what we see, and it's unfortunate, we see patients go into their doctor's office and now they're just kind of in awe. They're standing in front of a physician and they don't really want to tell the story. They don't want to be honest about everything that's happening at home, or they don't want to waste the physician's time with a bunch of questions. And that's really a disservice to the patient, because those questions need to be posed and they need to be answered. So the palliative practitioner gets to spend a little bit more time with the patients and really dive into some of those more complex issues. Again, we're seeing these patients at home, so we are able to kind of gauge what's happening in the family, which plays a huge role in the patient's prognosis. And so we're able to address some of those things. Sometimes that means that we're employing spiritual counseling, or we're getting social work involved because there's moving parts, and maybe we've got a patient with a dementia diagnosis, but we don't have a power of attorney yet. And the family's like, how do I get that taken care of? So we start to get all of these pieces. We start to pull in all of the pieces that are missing and start to work that out for each patient. Huge benefit when you have a lot of moving parts and difficult to get to physicians. Palliative care is insurance-based. So straight Medicare has palliative benefits. Some commercial policies also have it, but it is insurance-based and requires a doctor's order. So if you guys have questions about that, I'm happy to stay behind. I've also brought Brandon from Nevada Palliative and Infinity Hospice, and we can answer those questions. I think that palliative care is very specific to each individual, and so it really does kind of require a conversation and go over kind of what's happening and what areas are being missed, where are those gaps, and we can work on bridging those gaps for you. Unlike everybody else up here, I work for 2 companies, so I get to go into the next one. Our Nevada Palliative Care is a sister company to Infinity Hospice Care. And whenever I come up, there's going to be somebody behind me that you want to talk to even less, but he's good looking, so you might enjoy that. But hospice is difficult, but out of everybody in the room, I say this, that end of life is my Zen garden. I actually worked in the funeral business before coming to hospice. and I've used hospice for both my mother and my father and my brother. So I'm very familiar in this area, and one of the reasons that I joined this organization was to get out into the community to talk about how important it is to not stigmatize the dying process. I have 4 kids, and each of them had a celebration. You know, we celebrate life, we celebrate birth. They do these elaborate, you know, sex reveals, like the gender reveals, and we spend a great amount of time and energy and happiness and joy surrounding this birth. Before the child's ever stepped into the world, we're celebrating them. But we don't do that as a culture for individuals that are leaving this earth. And that really, to me, and I get to go out and meet these people, and I just wish we were celebrating them more. I mean, Blake will talk about celebrations of life, and we do that after the individual's passed away. But far too often, too many patients on hospice are isolated in the discussion, and they don't feel like they have. Is that up here? I think it's up here. Oh, okay. Those individuals do not feel supported in the end of their life, and that really is a great opportunity to employ hospice. Hospice is a home-based, it's really an all-encompassing comfort care, and it's done at home. It's a home-based comfort practice. We bring our nurses into the home as well as CNAs. So we're really bringing all of that medical, all of those different components to the home. We do bring in social services, spiritual support. We offer bereavement services for the family for up to 1 year. At this time in an individual's life, they may require some additional equipment. We get that for them. And we can help with some of that planning, the afterlife planning, and wrapping up some of those loose ends. It's such a beautiful program when employed at the right time. Too many people get employ hospice at the very, very, very end, and while that's really important, it doesn't benefit the family and the patient the way that it was designed to do. So I don't always kind of talk about some of the less discussed parts of hospice, but it isn't just for the patient, and I think that's a misunderstanding sometimes. Sometimes this is an opportunity, a discussion that comes up, maybe a physician's bringing it up and we say, or we hear too often the patient say, I'm not ready. But what doesn't happen is that patient doesn't turn to their spouse or to their children and say, but do you guys need the help too? Are you guys ready? And that's a really, really important part. A true hospice discussion, I think anybody in the room that has kind of had to veer into that territory really takes about at least an hour. It's not a 5-minute conversation. It's not black and white. There's so many areas in between. And I'm just so excited that you guys have come here today. You're open to those discussions. I will stay behind, and if you have any questions, I'd be happy to discuss. And because of the nature of hospice, some people may not want to talk about that here. And so I've left a form over there. You can put your name and number, and I'd be happy to give you a call. It's such a beautiful program. It's the largest Medicare benefit in the United States, and it's far underutilized. And it really can impact people at the end of their lives and their families as well.